Primary healthcare centers, often described as the backbone of rural healthcare delivery, play a vital role in providing essential medical services to communities. However, in many rural areas, these centers continue to face significant challenges that hinder their ability to serve people effectively. Our correspondent Hayatu Bala Nasara reports.
During a recent visit to Mayama and Suru local government areas of Kebbi State, the Permanent Secretary, Minister of Health, Dr. Abubakar Zaki, alongside Executive Secretary, Primary Healthcare Development Agency, Alhaji Abubakar Muhammad Nuba, and other directors of the agency, observed varying conditions across several facilities. At Primary Healthcare Giwa Tazo, staff say they attend to an average of over 100 patients weekly. Yet, they face shortages of drugs and medical equipment. They say they are trying their best, but they need more support from government and partners. In PHC Suru and Karai, the story is much the same. Although the centers are functional, facilities are overstretched, and patients often travel long distance to access care. Despite challenges at the centers, some patients express their happiness with the services received. They say the personnel are accommodating and caring, and always show professionalism while discharging their duties. On his part, the Permanent Secretary, Ministry of Health, Dr. Abubakar Zaki, said they are aware of the challenges, and the state government is working with the Primary Healthcare Development Agency to address manpower and supply issues. He said plans are on their way to renovate more centers and improve service delivery.
Most of the facilities in Kebbi State, health facilities, they have suffered 12 years of neglect, total neglect. Some of them are in total state of disrepair. But with the present government, Dr. Nasir Idres, Gwandu, His Excellency, has shown a lot of commitment and dynamism in bringing the best out of our healthcare system, both in terms of infrastructural development, renovation, renewal, as well as equipping our facilities.
Also speaking, the Executive Secretary, Primary Healthcare Development Agency, Alhaji Abubakar Muhammad Numa, said despite challenges, health workers in both Mayama and Suru PHC centers remain dedicated, attending to patients with the limited resources available, which he said is commendable.
From what we have found in these primary healthcare facilities, there is an achievement from our last visit. A lot has been achieved, both from the cleanliness of the facilities, service delivery, and also documentations.
It is hoped that the state and local government authorities will act swiftly to strengthen the primary health care system, ensuring better access to quality health care for all residents. I am Hayatu Bala Nasara, reporting for South Eye Africa from Birnin Kebbi.